Dengue fever is caused by a virus. It's caused by a virus which was similar to the viruses that cause yellow fever and what most people know about West Nile fever. So it's a virus in that family, and it's transmitted by the mosquito. It causes what's been described as a very bad flu. One of its other names is breakbone fever. But it can become much worse depending upon the type that people get and then how many times they get different types of the virus. Malaria is actually caused by a protozoan parasite. It's a small single-celled organism and basically feeds on red blood cells. So the principal symptoms associated with malaria initially are the anemia. It's accompanied by a very high fever. And if things get bad, meaning that there's a blockage of blood vessels in the brain, for example, people can go into a coma. And at that point, it can become fatal. For dengue fever, 1/4 of the world's population is at risk. And of those that actually get the disease, which is several hundred million, about 50,000 die every year. Malaria is much worse in terms of fatality. About the same number of people are at risk, about the same number of people get malaria, but in this case, 1 to 2 million die every year as a consequence of malaria.
So the first time that I was exposed to vector-borne disease, I was actually doing some work in Cambodia. And I was there during a pretty serious hemorrhagic dengue outbreak. And I took a friend of mine to the hospital at that time, and the hospital was literally overflowing with sick. There's 2 people in each bed. And the windows are open to mosquitoes. So I'm in the hospital, and I'm getting bit by mosquitoes inside the hospital. So initially for me, that was the first time that I've actually seen this, on a personal level, and just seeing something like the screening on the windows. So that's something that's so simple, a simple intervention that can go so far to helping reduce transmission. It's really highlighted the ways that we can have very simple changes, small changes, cost-effective changes that make a real difference on the ground for people.
When I travel to these developing countries, the one thing struck me very much is the lovely children and their caring mother. And what I really want to achieve is through our work, to reduce the disease burden for them. The leading challenges of global health are 2. First is we need to develop new technologies for diagnosis, for treatment. So the second challenge is how can we translate our funding to actions for disease control diagnosis in developing countries.
So my work focuses on anthropogenic change, land use change, deforestation, and how that affects mosquito populations and downstream malaria transmission. When you see these highland sites, when you're driving through, it's a beautiful landscape, but you can see that it's becoming a patchwork of deforested areas. When somebody wants to deforest an area, let's say around their home, their village home, they'll cut down the trees, and presumably they're doing that to start agriculture, to make an agricultural plot around their house. But essentially a lot of times what they end up doing is, since this is on a hilly area, they'll clear out an area to grow the crops. They'll dig drainage ditches because you need the rain to drain out of your crops so it doesn't flood your crops. And these drainage ditches end up being perfect mosquito habitats. So essentially when you're building that farm around your house, you're also building a mosquito farm.
Infectious disease is not only a problem for people living in developing countries or in remote, least developed places. It's also a problem for people living in the urban area. For example, in the summertime, when we travel to Guangzhou, where we started a dengue project, we saw the city is going through rapid expansion. The new buildings, older buildings are being demolished and replaced with high-rise apartments and office buildings. However, in this area, we see a large number of mosquito breeding sites. And this mosquito contribute to the transmission of dengue in the suburban area of Guangzhou. We see a number of dengue cases each year, and every 3 years there's a big dengue outbreak in the area.
So the efforts that we're putting on are actually trying to work toward a sustainable solution for controlling both dengue viruses and malaria. We're looking for solutions that will have a lasting impact. Our work with malaria has focused on trying to engineer genes that would essentially make the mosquitoes resistant to the parasite. And work in the laboratory has been to develop genes that would actually confer a resistance on the mosquitoes to the malaria parasite. At this point, it works quite well. It's not 100%, and we're striving for 100%, so that's what we're working on now. The next steps involve coupling the genes that we're building that make resistance to a system that moves it through a population very quickly. So we have what's called the Grand Challenges in Global Health Award, which is administered actually by the Foundations for NIH. And it started as a group of people who had very distinct knowledge in different areas: ecology, molecular biology, virology, coming together to see if we could actually build mosquitoes, in this case, that were resistant to dengue viruses. And so a group of us got together to see if we could not only make the mosquito, but then to bring this new tool from the laboratory to the field. We're at the point now where we have a specific product. We've built a mosquito, the group has built a mosquito where the females don't fly. So you can release males into a caged environment, which is where we're at now, and those males will mate with the target females in there, and their daughters won't be able to fly. So with time, the population crashes. We're doing the groundwork necessary to set up small open release trials.
It's been a pretty exciting time at UCI for public health and global health in general. Started up a public health program since I came here, and there's also been some global health programs that have been going on, one of which I was able to get funded to go to Kenya to help me fund my last trip this past year. The UC system in general has been very supportive of global health research and really pushing to serve these underrepresented areas, so it's been really good.
The University of California system is so renowned worldwide, so that it's possible to attend meetings and form collaborations with labs to try and bring our resources together with those of other labs and share our expertise, making an international collaboration to solve this problem.
I'm really proud of my work at UCI because we have improved our understanding on malaria epidemics.
For malaria, there's been a call for eradication, and we're now talking about the complete absence of the disease in humans and mosquitoes in a worldwide context. When I think about this as the challenge of a century, because I think it's probably going to take 100 years to make it happen, but we have to start somewhere.
Since I've been exposed to this and seen insect-borne disease and tropical disease and what it can do to a community, I think it's important to look at these things on a small level so that we can then build them up to a larger community level, country level, continent level, and then attack that whole malaria belt that kind of goes around our whole globe.